Hi, Don here. Welcome to Podiatry Practice Mastery. We're helping you get your practice to the $1 million mark and beyond. So the question of the day is, Doctor, hey, why do my nails grow so fast? And I always answer them the same answer, because you're watering them too much. And then I always tell my patients, well, you're in the golden years, and the patients always tell me, well, the only thing golden is my urine, and I say, well, the only thing golden is your toenails. So those are some of my toe jokes of the day. I tend to have the same ones I say over and over. So today was a half day. It's a Friday, so it's a half day nail care. So I do nail care half day a week in the mornings. I usually have Marjorie. She's on vacation. So we are about a little over 3 months into ModMed. I'm still seeing some routine patients that aren't in ModMed, so I'm not back into doing diabetic foot exams once a year or PadNet. Only because Morali is running so far behind from me. He has to play catch up, and I need some type of a trigger to remind me to do those. I tend not to open up every chart every time. I would love it if there's a way I could print out a list of those that I'm seeing that day that are due for the diabetic foot exams or PadNets. That would be something good. They probably have it in there. I'm just not sure how to do that. So if you do know how to do it, let me know. Shoot me an email, don@podiatrypracticemastery.com. Okay, so during lunchtime, there was a rep that brought in something for a nerve stimulator that you would use for diabetic neuropathy. I think an anesthesiologist would implant that. That's kind of a neat idea. If for someone that's not going to work with Utenza, doesn't work, or someone that maybe doesn't have diabetes and still has neuropathy, I think they can cover other diagnoses as well. So that was something that was kind of a neat idea. Patients for the day: 68-year-old female, left second digit hammertoe. I did precautionary an injection of the second MPJ, kind of plantarly with ultrasound because of a big bursa down there, and she felt better, less swelling, but she still has a hammertoe up and she would like it fixed. So we talked about doing an arthrodesis with a possible plantar plate repair. Next was a 36-year-old female for left sinus tarsi pain. She's in marathon prep mode right now. Did a cortisone 6 months ago. Pain came back. Doing another number 2. This is her first marathon. So I said if the pain comes back again, we'll probably do an MRI. Or possibly, I don't know if it's even possible, but having one of my friends do a scope in that region to clean out those kind of joint. I think they're a little too small, though, for that. Next is a 70-year-old female that had a matrixectomy on both edges of left hallux, so that'll be a 3-week follow-up for those. I do one follow-up for matrixes. Next was a 76-year-old. This was one of my nail care patients of the day, but it's kind of unique how I kind of think about it. So I did an office visit for her rash. She had rash on the left foot. Did nail care, office visit. And she had previously been given ketoconazole. I offered a biopsy, but she preferred to do a different medication, so I did clobetasol. And if that doesn't improve, I'll do a biopsy in the next visit, at her next routine care visit. Next was a kind of an interesting patient. This was a patient that found us online. So we've been getting a lot of patients online. So just a word, this has been really working for us well. And I'm kind of joking. I think I'm kind of, doubtful sometimes of the things that I do to see if they're going to work or not. But this patient came in, they found us online. I had 2 today, came in because they're looking for an urgent care, and we put up a recent page on urgent care podiatry. So if you want to look at mine, go to centralmasspodiatry.com. You can see mine. You can kind of clone it if you want or do something similar. But he had a knife that fell on his toe, and he actually transected his extensor hallucis longus, perfectly. He couldn't lift up the toe. So I introduced my buddy Matt, who's in practice with me, because I'm going on vacation next week, and he's going to be fixing that tendon. But I got an office visit, surgical scheduling, and for Matt, and then I did an ultrasound as well. Next patient was a 59-year-old man who got number 2 out of 6 for plantar fascia. He is not feeling better yet, but he did the Shockwave. Next was a 31-year-old female for an IND. I'm not going to do any follow-up for the IND, but she is also another one that came 30 miles because she searched for, specifically she told me, I searched for podiatry urgent care, and you came up. And I'm like, wow, that is great. Next was a patient, 31-year-old female, has nail fungus. I talked about skipping the first visit, doing the Lamisil with a fungal kit, and she's going to be doing that. I'm going to see her back in 3 months. And next was a 47-year-old male that had right Achilles insertional tendinitis. He had that in the left in 2023. Now he has it on the right. He has the bump back there. He, in the past, did 3 Shockwaves. And now this is kind of a challenging conversation. So he had 3 in the past, and now I do 6. And he's like, well, why do you do 6 and you only did 3 in the past? Well, I said, because in the past I used to do 3 shockwaves, and then I did physical therapy, and I find that I don't need to do the physical therapy anymore. It saves them time, saves them money, and that's why I do 6. So he only wanted to do 3 because he was used to 3. So what patients always expect is what they had in the past. I think this is the takeaway for this one. So if they've had 3 in the past, they're going to want 3 again. And that also goes throughout your practice. Like, oh, Dr. Feldman in your practice treats it this way. How come you treat it the other way? So those are things. So that was the day. Until next time. Okay, thanks, guys.